Once considered elective, single embryo transfer now represents the best standard of care for all IVF patients. That includes for surrogates and even moms like me who were a little bit on the older side when we did our embryo transfer. Here with me today is Dr. Serena H. Chen, my dear friend and truly a phenomenal reproductive endocrinologist from IRMS, New Jersey. And I'm Alice Crisci with MedAnswers, creator of the Fertility Answers platform. Thanks so much for being here with me, Serena.
It's so great to be here. I'm so glad to see you.
I'm so glad to see you. And this is such an important conversation because patients go into this thinking, hey, maybe this is a 2-for-1 deal. But tell me what has changed, because 12 and a half years ago, even when I did my transfer in 2008, I did a double embryo transfer. I kind of feel sheepish even admitting it. And I was terrified my entire pregnancy I was going to end up with twins because I was worried about the risk of complications and I was worried about being a single mom by choice of 2. So what has changed that has made it possible for us to feel so confident that single embryo transfers, also known as SCT, is the way to go?
Okay, so I think there's 3 big things. One is freezing. Freezing has changed. We are much, much better at freezing, so we don't feel like we're harming anything by putting embryos in the freezer. It used to be like we were like, oh, are we harming our extra embryos? Let's just put it in. But now we're so good at vitrification. It's like pressing the pause button. The survival rates are phenomenal. And the implantation rates don't seem to be affected at all. The second thing is that we're just a lot better at growing embryos in the lab, and the pregnancy rates are just much higher with single embryo transfer. And when you start to get a super high implantation rate and the miscarriage rate for twins remains the same high level, we're starting to see that the numbers just make a lot more sense. You actually end up with more healthy babies and less complications transferring embryos one at a time. And then a lot of people are making use of pre-implantation genetic testing. And so that like levels the playing field in terms of age. So a single embryo that is genetically normal will have the same implantation rate in a 25-year-old versus a healthy 45-year-old. So just incredible changes coming out there. And what we're seeing is if you have 100 women with 2 gorgeous PGT normal embryos and 50 of them transfer 2 at a time, and 50 of them use their 2 embryos but only use them 1 at a time, the people who use them 1 at a time, single embryo transfer, end up with, say, 80% take-home baby rate and a much lower miscarriage rate, whereas
Wow.
the people who transfer 2 at a time is more like a 60% pregnancy rate and a much higher preterm delivery rate, miscarriage rate, complication rate for both the moms and the babies.
I love how you just explained that, because now what I'm realizing is if you transfer 2 at a time, you're literally wasting an embryo.
You're literally wasting an embryo, and they'll keep forever. They'll be fine in the freezer. So
wow, that's heartbreaking.
why waste an embryo?
Why waste an embryo? Can we also talk about what's wrong with two at once in terms of complications when women are carrying multiples? You know, you see a lot of multiples in surrogacies, and people are paying a lot of money to embark on the path to parenthood this way. It is hard for people to get that point that it isn't 2 for 1.
I know, especially with surrogacy, because surrogacy seems so expensive. But I have a friend actually who had his 2 children separately, 2 surrogacy pregnancies, and he happens to also be a high-risk maternal fetal medicine specialist. And he always says to me, you know what, people don't realize, they see the upfront cost seems lower because you're saving the money for that extra IVF cycle. But what people don't realize is what is the cost of not just having a miscarriage, but having a preterm delivery, having a baby in the NICU for several weeks, and then all the extra care that that baby requires at home. And then often you have, you know, 2 parents, one of them often has to quit their job because of all the extra care. And we're not really So when you're talking about cost, the IVF cycle pales in comparison to what the impact of a twin pregnancy and a twin delivery and the extra care that twins growing up may require of their parents. Because, you know, if you have a preterm delivery, you often do have children with more medical needs and more possibly educational special needs as well.
So there's risk to the pregnancy itself, gestational diabetes, high miscarriage rates
Yes.
of twins,
Preeclampsia, high blood pressure,
cord
a lot
entanglement,
of risks to the mom or to the carrier. Yeah.
and then those NICU costs. Oh my gosh. I mean,
And
you
then
know,
once you bring
these,
the babies home, you know, you have a baby in the
right.
NICU for a month, some of them will do great and do fine and not require any extra care, but a lot of them do require, you know, some extra medical and, you know, kind of educational care, you know, like there definitely can be almost a lifetime of extra care. Like preterm delivery is not just a small baby in the NICU. Small babies in the NICU often require a lifetime of extra care, and there are, you know, there's significant cost to that, to the parents and, you know, to the healthcare system.
Absolutely. And I think this is one of those times where people who get really attached to the idea of twins and how cute they are and
They
the
are incredibly cute.
adorableness, they're
Yes.
so cute. I know lots of twins. I have twin nephews. Uh, I have twin friends. You
But
know,
the thing that the doctors see is, like, we see that the death rate, the neonatal death rate of the babies, 3 to 10 times higher
wow.
for twins
And that's
than
really
for
scary.
singletons, even in the United States. You know, theoretically, we're really good at taking care of babies in the United States, but it's really tough on babies. Twins are routinely deliver at least a month early. Some will deliver close to term, but the average is at least a month early, and that means a lot of babies deliver even earlier than that, and that
Are
can
C-section
affect.
standard of care if you're carrying, if you have a twin pregnancy, are
It's not
scheduled?
standard of care, but they're much higher risk for
Mhm.
you know, for a cesarean section, because, you know, the positioning when you have twins is much harder, and
Sure.
because of all the high risk medical complications that you can see.
Got it. So I think that the take home of that is that as cute as they are, and as many times as you look to your right, you look to your left, and you see healthy outcomes, though that's actually the rarity. And this is one of those times where that risk benefit ratio really does make a difference when you're looking at the cost of IVF and taking into
Right.
consideration truly the lifetime cost if your twins end up with health complications,
Yeah.
which is more the norm
Yes.
than not. So I think that that is, you know, one of the most important things to get, even with you're working with a
Right.
surrogate.
And that's standard of care in the United States and Europe. Single embryo transfer is standard of care for the vast majority of IVF patients today, because our technology does such a great job of getting people pregnant, and because the risk of twins is still very, very high.
Absolutely. And you know, as you and I have done so much advocacy work with insurance carriers, doing a single embryo transfer and making that case that we can reduce the rate of multiples, we can reduce the overall healthcare costs
Yes.
to the system by you know, covering a single embryo transfer, then makes really good economic sense for the carriers across the country.
Yes.
So that's something we've been advocating for a long time. So I want to close it off there. You know, this is your typical Monday motivation with Alice Crisci and Dr. Serena Chen. Single embryo transfers are standard of care for a reason. The data proves that one is better than two, one at a time, even with the cost of IVF more than once. So
Yes.
thank you so much for being here, and I will see you next time.